Could loving someone sometimes mean not offering the advice you're trained to give? What if the real healing in families isn't from being right, but from staying connected?
Where do you feel the tension between love and medical authority, especially with adult children, aging parents, or extended family? Have you ever noticed how hard it is to stay quiet when someone you love makes a medical decision or says something that is different than the way that you were trained or from what you know because of your extensive medical expertise?
Yes, is the answer. What happens inside you when your expertise isn't wanted or isn't followed? Today's episode, we are going to share the bumpy terrain between being a doctor and medical things going on in families. Thanks for joining us today at the Healing Medicine Podcast. Who are you listening to? I am Dr. Jessie Mahoney, and my co-host is Dr. Ni-Cheng Liang. We are two board-certified physicians who bring decades of experience to the conversation about wellness. If you crave more ease and aspire to rediscover your love for medicine and life, one mindful step at a time, you are in the right place. We hope you'll love today's episode, and if so, please share it. A reminder that nothing in our podcast is medical advice. So today's episode came up in large part because I have two awesome, amazing twin granddaughters who were born a few weeks ago at home. And I'm a pediatrician, so this is, of course, not what I would recommend, but it was apparently deeply aligned with my son and daughter-in-law's values. And navigating this process has brought me through a lot of mindfulness and coaching and a pretty profound exploration that has involved a lot of growth, love, and humility, and I would say a lot of feelings. And so several people who have asked me about the story and how did I respond and all of these things, they said, you really need to do a podcast on this. And so here we are. And it isn't just about this experience, actually, because I think so many of us have had experiences with loved ones who reach out and ask. And sometimes we are resentful of being asked for all our advice. And sometimes we're resentful of not being asked. And then how do we respond when they make their own choices about what they want to do? So this is such a juicy topic for us to lean into. And as we do, my intention is to remain non-judgmental of myself and anyone else, and to remember that the core of all of this family stuff is love, and that when we're trained in medicine, that part of us doesn't disappear, and it's really hard. I think I initially had this idea, well, I'm going to be a grandma and not a doctor. That's actually not possible for me because I am both a grandma and a doctor. And so to just recognize it doesn't mean that I'm going to be their doctor or it's my job to mention things. And actually, I've looped back around to being more of the doctor, interestingly, over time. But to just recognize it's not all or none. And that for me, in fact, being a doctor is much more familiar than being in the grandma role. And so we're going to learn. And over time, I will learn. And can I have compassion for both them and me?
So, this episode holds space for those of us who love deeply and carry medical expertise. We'll navigate the delicate edges between offering guidance, respecting autonomy, and prioritizing and managing our own hearts. We hope that you will feel less alone in all of the different emotions that arise, like grief, feeling overstretched, tender, frustrated, angry, and confused when these situations inevitably arise, whether they be with our adult children, aging parents, or family who ask us for advice and then they don't follow it or push back.
or don't ask for advice when you think they should. I also wanted to add in something that has come up for me big time in navigating this, which is a lot of grief about our medical system and some deep sadness that healthcare is literally so messy and so mistrusted by so many people and so hard to navigate that even people we love and people who believe in science often are choosing now to opt out. And I find that painful as someone who believes in it and also fully recognizes that it's a mess. And so to recognize that in the United States these days, that's where we are, makes me literally deeply sad for myself and those I love. So I wanted to just dive into this idea of navigating what happens when people don't ask for our advice. And I think very often we have a lot of thoughts and ideas about how to handle when they do ask and what they choose. But how to handle when they don't ask was for me a whole new frontier. And just to honor that it's humbling and a little bit disoriented and confusing. And as a pediatrician, I have spent my whole life at work and not at work being asked for my opinion all the time, even when I didn't necessarily want to provide it. I just wanted to be watching a baseball game or enjoying my dinner or something else. And so then to not be asked when I feel like, oh, they should want my opinion was a whole different experience. And it brought up, I would offer like some confusion and sadness, and just recognizing that there is space we have tons of cultural differences and differences in people's opinions about medical intervention. And, I had a lot of thoughts that my opinion would, of course, be wanted and valued. And that is this about that. And I think my ultimate stance is it's not about that at all. And I started to think also about this idea, like, did I ask my mom for her opinion when I was going through this? No, I did not. And so my paradigm of choices was different. And maybe we were more in alignment, or maybe we weren't. Like my mom, I'm actually looking back, I think she did a great job of not telling me what she thought. And so maybe I should learn from her that maybe it's not our role. And I think we think because we're in medicine, it is our role. But actually, it's not our role. And that people do get to make their own choices. And I'll talk a little bit about how to feel at peace in the end. But I think when nobody asks you, it's definitely not your role to provide your opinion. And so what was my role? And I have done a lot of thinking about this. And my role is really to show up with love and to show up connecting and to be present and not judgmental, because that's actually my role as a grandma, no matter my training. And so it really brought me into the mindfulness approaches and tenets of like patience and compassion. And we were trained to strive. So I have to not strive. And we were trained to judge, and I have to not judge. And really what I want is that connection and love. And that sort of mindfulness space has been super helpful. And it has allowed me also to show up neutrally when people do ask my advice, which they do sometimes. And so again, just recognizing that how we choose to show up determines how people choose to engage with us, and that is in our control.
So for me, I'm going to put out there right now, I'm not going to mention family members by name or relationship to avoid violating HIPAA. Yeah. And in general, just to respect and protect their anonymity, just in general. So with lung conditions in particular, as a pulmonologist, of course, I have strong opinions and acute knowledge of newly developed evidence-based guidelines or studies, etc. And I actually have to be very intentional about sitting on my hands or holding back when I think a close family member's asthma should be handled differently or slightly tweaked. And I will always offer and like communicate with the pediatrician, but not impose it such that like you must do this, like no ultimatums. I do it in a very respectful way. And I am also I try to be anyway, understanding and flexible if the pediatrician doesn't necessarily agree with my recommendation or question. So with pulmonary medicine, I think it's a little bit different than just general health and preventative medicine because of my day job being so entrenched in the world of lung health. When it's about preventative medicine, like internal medicine, we'll put on my internal medicine hat here. It's honestly quite frustrating and at times angering. And using your phrase, I find myself being lovingly amused at times when it's a benign situation. So I'll share one of those kind of humorous situations that I find humorous anyway. The family members probably don't find this humorous, but I find it humorous. So certain family members have become enamored with a certain type of vibration plate. If many of you might remember pictures from the olden days, quote unquote, maybe in the 50s or 60s, with oftentimes actually women were depicted standing on these vibration plates that had like a handlebar, but then they also had a strap, like a large wide strap that went around their buttocks or their waist. So that was purported to help with slimming and weight loss potentially. Well, now there's the vibrating plate fad, if you will, and my certain family members have very high regard for this device. They think that it's a panacea, but I, of course, being a medical professional, don't believe that it's a panacea. And particularly when certain family members have had surgery and there's hardware, I don't necessarily think that that hardware should be vibrating at such high frequencies. So that's my opinion about that. And I have shared my concerns with that family member, but ultimately taking in some of the coaching tenets of you really can't control the actions or thoughts of others, no matter what, basically. Another family member, to give you another example, is blissfully and wants to remain blissfully unaware of their colonic health. Despite reminders multiple times a year from their primary care physicians and from me and my brother is also a physician, it's really ultimately a flat, big capital NO to getting a colonoscopy for screening. And so at this point, after years and years and years of really pleading, I have decided that I'm letting go of having to have that discussion and letting the physician of that particular family member really be the one that is leading the way in counseling for this, because the emotional currency, the toll that it takes for me to inevitably experience the frustration and anger, it's too high. And honestly, I can do so many more things with that energy that otherwise
It's
would have been
not where love would spend her energy, right?
Exactly.
Because I would say, like, advocating for that while we think it's loving is actually interfering with your ability to love that person because you're frustrated. And I have family members who are in that same situation. I think everybody has family members that are in that same situation. But somehow in medicine, they told us it was our job to make sure that everyone in our family, is doing what they're supposed to. And it's actually not our job. And you might say, well, it's their doctor's job, but then what if they don't want to go to the doctor? Then, like, whose job is it? But it's a reminder that this is their story and their journey. It's not yours. And most of the time, it's not because they don't know about it. It's a choice.
And we can honor their autonomy,
Yeah.
their patient autonomy, basically.
Yeah.
You can bring in Mel Robbins' let them theory.
Yeah.
And I can be honored for my own thoughts and beliefs and expertise, and I can honor my family members' autonomy and give them their own space for having their own thoughts and actions. I wanted to paraphrase, giving a shout out to the latest Wicked film, For Good. The Wizard of Oz, and I'm paraphrasing this quote from him, basically says that people will believe what they want to believe, regardless of what facts you spew at them. If there's such an entrenched, oftentimes emotionally attached belief, it's not often that you're going to get people to change their minds about something when they believe it to their core.
I also want to point out that a lot of what we believe, like we always think that science is going in one direction, but there have been times where we recommended vaccines that then we decide not to recommend. And so it isn't always linear. And so while we think something is right, we don't always know that. We say, oh, it's evidence-based, so it's right, but we will have more evidence. And so this idea that we're the right ones can really get in the way of relationships. And it reminds me of our recent episode, like we don't have to be right or prove that someone else is wrong. They literally get to choose their own path, even if we love them. And I'm reminded also of something that I often brought up in pediatrics, which is, what do we both want? Like, we all want happiness and health and longevity and, longevity with high function. I think that everybody wants that. And so we just have different ideas of how to get there. And if they come to us as a patient, yes, they want our opinion, but most people in our families are not coming to us as patients, even though we kind of see it as our job. Do you think there's a component of feeling like other people will judge us too, like if our family members haven't done the things that we think in medicine they should do?
Yeah, I think so. I think even particularly on a subconscious level,
Yes.
There's potentially maybe a shame component that comes in too.
Yeah.
Especially if there's like a bad outcome or a bad discovery that could have been easily prevented with evidence-based preventive medicine.
Yeah.
I absolutely think that there's
and that's something that I think is worth bringing up here is, and I will say, so many people have, bombarded me with questions, and all from a very well-meaning space. But then I have also started to be like, oh, well, like, how come I didn't or I couldn't have, when really that wasn't my job? And I am actually at peace with all of this, right? Like, people get to do what they do. I've done a lot of coaching and I feel very equanimous and loving about it. And yet I feel like I have a lot of people in my world who are in medicine who are not there, but that's their journey. It's not my journey. And I think that this isn't just like we judge our family members, but then we judge ourselves and we worry if other people are judging us. And it's just this layer upon layer of judgment, which is, it's almost funny now that I look at it from that point of view. And I do think it is part of this idea that in medicine, our job is to be sort of a savior. And that maybe that's actually not our role. And for me, it's been really clear thinking about, well, what is my role? And my role is to love and I do think it's to inform, you do want people to know your thoughts in a kind and neutral way. Like, oh, the way I was taught was X, Y, or Z. It reminds me a bit of being a pediatrician, where you'll have multiple generations and the, mothers and mother-in-laws are coming in with their daughters and sons who are coming in with their children, and everyone wants to prove that what they knew was right or what is now is different. And if you look at it in that generational context, like what we thought was best, 50 years ago is different than what we thought was best 25 years ago, which is different than we think is best now. And they're actually all probably fine.
Yeah, a lot of it also, like the I'm righter than you, or like, see,
Yeah.
I proved you wrong type situations. Those are, as you're reflecting that,
Yeah.
pretty ego driven.
Yeah. Yeah. It's interesting.
You're going to one up like your family member.
Yeah. Yeah. And, and we have the story of how we've trained for so long and we know all these things and it's just like, it's fascinating, honestly, and a little bit funny. And it makes me think. So I have decided that my job is like a consultant, as a family member who has training, and we don't I'll just say it, like the GI doctor doesn't give you advice unless you go to see them. And so we are the consultant. And then consultants actually give advice that people don't take. And in fact, as a pediatrician, a lot of our patients don't take our advice either. We just don't necessarily see it as blatantly as we do with family members. And so again, I really like this idea. Even as a primary care person, we are a consultant and we have advice and we can be an advisor, but it doesn't matter. People get to choose and they get that autonomy. And I think when we were really taught in medicine that we can convince people and there is a right way, and, things that are out of our control are in our control. And that's really, our own personal journey. And what I think I've learned most about this is it's really about me, and who I want to be and how I want to show up, and really what love looks like. The other thing is that we're trained to think like if you don't do X, Y, or Z, terrible things will happen. But actually, they don't always happen. In fact, things turn out okay a lot of the time. And really, a lot of our recommendations are to prevent a worst case scenario. But things can turn out well in lots of scenarios. And so this doesn't mean anyone listening should ignore the advice of their doctor. But I think just recognizing, when someone comes to you as a physician, it's a very different role than people asking for your medical advice or just not following general medical advice. It's not personal. I think we're so personally invested in it, given how much time we've spent in it. And these recent experiences, not just with the younger generation, but for me, the older generation too, right? At all realms, they all get to choose. And even actually my current generation, they get to choose. As much as I would like them to all listen to me, that's not actually my job. So I do think this recognition that like giving our expertise has nothing to do with whether we love someone, and then following our advice has nothing to do with how much they love us, but recognizing the emotional cost about giving advice, or even when you don't give advice, but the stories you might tell about it is pretty expensive.
Yeah, we have to uncouple our expertise and advice giving from love in general.
Yeah.
Like they're not following your expertise doesn't mean that they love you any less. And the converse is true. And you not necessarily providing expertise doesn't mean that you don't love them less either. Like you get to choose. Like the expertise you hold is separate than love.
Yeah, it is. But we confuse them.
Yeah.
And I also think we hear often that like, oh, well, then you should only focus on love and just pretend you don't have the expertise. And I think that's unrealistic as well. And so to hold that for those of us who are trained in medicine and who love people, which is hopefully all of us have people we love, it's complicated. And just, I think, to remember it's complicated. It brings me to this idea of just trusting your intuition and potentially asking your future self what she would wish you had done. And I think for the most part with our loved ones, we would wish we had stayed connected and valued the relationship moment more than whatever the medical moment was. But sometimes you'll wish you had informed or shared your opinion, even if they don't follow it. And in coaching, we often talk about, well, once you share your opinion and the other person does whatever they do, all that's in your control is how you respond to that, right? That's always all that's in your control. And so there is really an opportunity here to begin to trust yourself and really choose how you want to show up. It reminds me a bit of choosing how you want to show up for the medical system, which is also operating all separate from you as well. But in our professions, we have trouble separating those things out. So let's just talk a little bit about like cultural and generational differences. And I know that for me as a boy mom, I have a lot of stories also about, what is the role of a mother-in-law, or what is, like, if you're a boy mom, this is the influence you have. And what I've recognized is, like, these are just stories and it doesn't matter. And we're all showing up with different cultures and different generations. And I think my sons were raised in a very different generational time, and their thoughts about healthcare are very different than when I was raised about it. Things have changed dramatically. And so we can still all coexist peacefully as long as I stop insisting on things and they get to have their own journey. And when they ask for help, I can also offer it. Because I think the more neutral and the more non-judgmental we show up, then we do get asked for help and we can be helpful. And that is a beautiful thing.
When we talk about cultural integration of this complicated circumstance, the complicated label, I want to name that it's not a bad thing that it's complicated. It's complicated because there's love that's intertwined with the objective facts that we know and have practiced for many, many years. That's why it's complicated. And then you add in the layer of cultural complexity. So from my personal story is that being an immigrant and child of immigrants from Chinese, Taiwanese backgrounds, and then having had both maternal and paternal grandparents living in Taiwan during the Japanese occupation, there's even a little bit of Japanese culture also thrown into the way that my parents were raised. Actually, a lot of Japanese culture thrown into the way that my parents were raised. My family is pretty male dominant. And so there sadly was, and I have witnessed misogyny. And being a Chinese Taiwanese American woman practicing medicine in a male dominated subspecialty as well.
Complicated.
Right? There's a lot of complicated circumstances that arise. So I definitely, just by virtue of who I am today in this moment, buck the gender and cultural norms. And how I navigate the complexity is really honoring and prioritizing myself. Like, I will choose my battles very, very carefully and very intentionally. So ultimately, it comes down to, if whatever they are choosing to do is not inherently life or limb threatening, or not harming another person, of course, then pretty much let them is what is applied. And I will also be very intentional in how and when and if I even choose to share that I disagree with what they're doing.
Yeah, and I would say, honestly, even if it could cause harm, not to others, I think then maybe you speak up, but even if it could, like, where is your role and where is your place? And it reminds me of just leaning into what matters most. And if your relationship with that person matters most, then we can let that go. I think too, culturally, there are a lot of really cool things in other cultures that add positive stuff that, I think we make it an either or. And they can add a lot of really interesting healing approaches. And I'm thinking of mindfulness, and specifically, like, adding that into cancer care has huge benefit. We know that. And so it doesn't have to be, that I'm going to say, like, Buddhism and medicine are in conflict, because they're not, right? And so we cannot judge, and I really do think we have to allow people to make their own choices. And that is something in medicine that we weren't really taught to do because we were taught to convince. And maybe our job is really just to inform and share what we know and then let people make their own choices.
I'll call out that spirituality can be a large part of one's culture as well. And I don't think traditional allopathic medical schools have, at least when I was doing training, I know things have definitely changed now. But I think that the importance of spirituality as part of someone's well-being was definitely kind of understated in my medical training. So to honor that like having spirituality is definitely very important for health and well-being.
Well, and we know that's so important to outcomes, right?
Mm-hmm.
And so I think for some people, it's more important than the medical interventions. And I know as physicians, we say it's the opposite, but I think that they're probably both equally important. And when you deny someone something that feels so important to them, that in and of itself causes a challenge. There's so many really interesting pieces here. And I think the overall construct here is that it's complicated and we don't have to be right. And it's really a place for non-judgment of ourselves and our family members, and also of other physicians not showing up judging you or judging your family. Like, can we just remember this isn't about us, it's about autonomy. And it's a great place for love and loving amusement and letting go. And I also think noticing how things actually can turn out better than we think. Because remembering we're so focused on worst case scenario that it's hard for us to see. And even in retrospect, it's like, well, but what if? And I am doing this in the context of all of my family members, that all of my negative what ifs, even though they haven't done what I would have thought, everything's turned out really well. And so can I just feel gratitude for that and be happy that people acted with autonomy, whether it's the younger generation or the older generation, and it's turned out okay. Because none of them hired me to be their doctor, as it turns out.
So, as we like to do with every episode, we will close with some reflection questions. So, what loved ones bring up the tension between your medical mind and your human heart?
And where do you feel the urge to protect, control, and advise? And what might that urge be there for?
How do you feel when someone ignores your medical advice?
Which parts of you soften when you ask yourself what love would do? And what might trusting the next or previous generation look like for you right now? So some takeaways from today's episode before we close are that loving people across generations and cultures and medical differences is tender, humbling, and complicated. And it encourages us to release this idea that being right is what's going to keep people safe, and that it's our job to do that. And for me, certainly, it's a great reminder that connection is also actually medicine, and that if we want to remain connected, that we have to show up with love and not control and not as the expert. And also recognizing that this is often unfamiliar and takes practice. And so what we practice grows. And I have personally found that the more I practice, the better and better I'm getting at it. It's much easier. So I encourage you to begin the journey, because along the way, life offers all kinds of unexpected unfolding events that can turn out better than you imagined.
Thank you so much for our new recent reviews and stars. We so appreciate the support and ongoing listenership. And shout out to my patients who also listen. Some of my patients listen to this. And so a reminder to the healthcare professionals who are the vast majority of our listenership, if you find that an episode might be helpful for your patient, like please feel free to share that episode and about our podcast in general. It helps to spread the ripple effects of mindfulness. And as you know, from listening to our episode, a lot of our topics are very universal and not just for female physicians, even though that is the vast majority of our listenership. So thank you, and please continue to leave us stars and reviews. This helps us be able to spread the effects of mindfulness.
And a reminder that and no matter who we share it with, nothing we share here is medical advice. It's just our thoughts and opinions on living this beautiful, complicated life that we live in. And now is the moment for folks to sign up for spring small group coaching and or spring retreats. It's that time of year, and that is happening. And so if it's something you have been thinking about, you can go to my website, which is jessiemahoneymd.com or pauseandpresence.com, and find out about the different options for getting some coaching and working on your mindset so you can navigate whatever life brings to you in a more easeful and buoyant way. Thanks so much for listening. We appreciate all of you, and we appreciate your sharing and helping us grow this podcast over almost 5 years. So we'll see you next week.
Thanks for listening. If our message resonates, we'd love to connect further. Join us for coaching, mindfulness experiences, workshops, and retreats. Invite us to speak at your institution or conference. When you work with us, you don't just consume information, you create real change. Find me, Chang Liang, at Awakened Breath, and Jessie Mahoney at Pause and Presence.
Welcome to today's mindful moment, a moment of compassion, acceptance, and kindness. Considering that after listening to this episode, you might recognize that you have been taking on things that were not your job. You may have been taking on things that are not yours to hold and not yours to own. And that with that realization, often we go to judgment. How come I did this? How did I get here? And my invitation here is to simply bring your hands to heart if it's safe to do so, and close eyes if it's safe to do so, and find your breath. Reconnect to the breath. And take a moment here, hand on hand, hand on heart, melting that cortisol, stress, judgment hormone, sending yourself kindness and oxytocin, recognizing that until this moment, you knew what you knew. You couldn't know what you didn't know. And now, with new information, you can choose to move forward differently. You can choose to move forward from a place of kindness and love. And you can choose what you would like to be your job and let go of what is not your job. And if you notice angst coming up, anxiety, worry, what will happen if I don't do it? I might offer, what will happen if you do? Might other people never learn? Might they never grow? Might they just give you more jobs? What if you don't do it, creating a vacuum? It either doesn't need to be done. Maybe it gives someone else agency. Maybe it boosts their self-esteem. Maybe it offers an opportunity to someone else. Breathe in through your nose and out through your mouth. It's not your job to reassign all the jobs that are not yours. Taking in another big deep breath. A huge exhale. Acknowledging any angst or stress you may feel with kindness. Remembering that what's your job is to focus on what's your job. To be the best human that you can be. To show up with love and kindness and compassion. To show up mindfully. To be present. To be patient. To be accepting. To not judge. Taking in one more big deep breath, melting into the softness that potentially you feel now. And I invite you to explore this exercise further on your own, remembering this mindful moment, remembering the importance of bringing compassion and kindness to the project, remembering forgiveness, flexibility, and non-judgment, remembering the breath, remembering the feel of the oxytocin, pressing the heel of the hand into the heart, remembering the top hand, massaging the bottom hand, feeling the lightness and spaciousness. May you all be well. May you all be safe. And may you all move forward with a little bit less overwhelm, over responsibility, over commitment, over functioning, over busy, and any other overs you may specialize in. May you all move forward a little bit more light, a little bit more calm, and a little bit more peaceful. Slowly lower hands and open eyes. Thank you all for joining me for this practice today, and we will see you next week.